registered physiotherapist. Today I'd like to talk a little bit about the different types of knee injuries that I typically see in the clinic. And the way I'd like to decipher between the type of injuries are when somebody comes in with knee pain that's due to some sort of incident, right? A trauma of some type, whether it's a fall, it's a twist, it's an issue in which somebody was perhaps playing a sport and got hit a certain way. So those type of pains and discomfort versus when there isn't necessarily some sort of incident that took place, or the patient really can't come up with a scenario in which they either did a different activity or did some specific trauma or incident in which their pain kind of stemmed from that. So first thing I'd like to talk about are those traumatic, let's call it, type of injuries. So again, where there's been some sort of an incident that happened where after that particular incident, the patient develops some pain. So the way I look at the knee joint, so to speak, is you can think of it as, so you've got your femur here and you've got your tibia, right? And so surrounding that area, you have four very important ligaments, they're called. So what ligaments do, what their job is they actually help to stabilize, right, the knee joint. So you've got your ACL, it's called. Your ACL helps to stabilize the joint in more of an extended position. Your PCL, which is called your posterior cruciate ligament, that's more with regards to flexion. And then you have your MCL, your medial cruciate ligament, and then your lateral cruciate ligament. So what their job is essentially to provide stability going in or out of the knee. So the first thing we want to look at is, with regards to a specific trauma of some type, is are one of those specific ligaments involved? So has there been a tear of some type? Has there been a sprain? What grade of tear, right? So you can have a grade 1 where there's very minimal damage, let's say, to the ligament. You can have grade 2 where there's more or less a partial tear, and a grade 3 which is more a full tear. So depending on the degree of a particular tear in the ligament will correspond with what sort of intervention needs to be done. So for example, an athlete perhaps who is playing at a high level and has torn their ACL, well, that individual, kind of like Klay Thompson, who just had that severe knee injury playing basketball. So that individual is going to need some form of surgery, and it's going to be a fairly long rehab process, versus maybe somebody else who's just had a grade 1, let's say MCL sprain. That individual won't take nearly as long in terms of rehab, and quite frankly won't need any sort of surgical intervention. So it's just going to be again, conservative approach through physiotherapy. So those are the ligaments. Then on the undersurface, right, of this is called your tibia, if we're looking at it in this way, you have what's referred to as your meniscus. So you've got a medial and a lateral meniscus. And their job essentially is they act like shock absorbers. So sometimes during these sort of traumatic incidents where, again, if there's a plant and a twist, or if there's a fall of some type, or there's somebody who's been hit a certain way, the meniscus can also be involved. So typically with meniscus, you're looking at a plant and a twisting type of action, which will tend to produce pain. Again, there can be different degrees of injury with the meniscus, ranging from a full tear, a mild sort of irritation of the meniscus, and also depending in terms of an intervention with the meniscus, it really depends too on where the damage occurs. Certain areas of the meniscus have a greater blood supply than others, and so depending on where this injury occurs is going to correspond to whether, and also again the patient's activity level, is going to correspond to what sort of specific intervention, something more of just a conservative rehabilitation versus surgery. Again, it depends on several different factors. So that's sort of a basis in terms of a very, and there's other sort of traumatic things that can occur with the knee, but those are your big ones in terms of when you're thinking of specific knee injuries that involve, or pain that involves some sort of trauma to to, again, the meniscus, these different sort of ligaments that surround the knee joint. Now, on the other end, right, pain can occur in the knee joint where there isn't necessarily any specific incident or trauma that's occurred. So a lot of times what we're thinking with regards to that is something along the lines of perhaps a patellofemoral pain issue, so kneecap positioning. So you'll see this a lot with individuals who perhaps are starting a new sport of some type. Maybe they're starting to run more often, or for some individuals it's even with prolonged sitting. So what patellofemoral pain syndrome essentially is, it's where the position of the kneecap it's not essentially tracking very well. So there's actually a between the tibia and the femur, you've got a groove that the kneecap runs through. And so due to several different reasons, right, it could be muscle imbalances, it could be due to footwear in some cases, it could be due to gait patterns. The kneecap, it's not gliding properly, or it's not tracking properly through that area. And what ends up happening is the undersurface of the kneecap gets irritated with different activities. That could be going up and down stairs. That could be, like I said, prolonged sitting. It could be doing some new activity like squats, or going out, working out for the first time in a long while. So again, that's an example of a knee pain where there isn't a specific trauma. Another thing as well, pain could be coming just as a result of wear and tear. So arthritis within the knee area. And again, that could be something that just over time, an individual starts to get pain in through that area. Another sort of common pain within the knee region that doesn't necessarily correspond with a trauma of any type would be, it's called IT band friction syndrome. So your IT band runs from the hip all the way down to the knee, and kind of crosses the knee area. That IT band, or that connective tissue, it can actually get rubbed against the femur and tibia bone, again, just with an increase perhaps in activity. So again, when thinking about knee pain and the types of knee sort of discomfort or injuries, it's really important to distinguish between, okay, are we looking at something in which there might be something structurally, right, going on with regards to a specific trauma, a tear, whether it's a full or a partial? Has there been a specific incident? Is there swelling? Is there bruising in the area? Versus insidious onset of pain, nothing specific that occurred, and what might be going on with regards to that. Thanks so much for watching, and again, if you have any specific questions or comments, please feel free to leave a comment below, and also please subscribe if you're enjoying these videos. Thanks so much, and take care.